Good evening, everybody. Thank you so much for joining us this afternoon for our third Through the Eyes of a Physician webinar. Again, just as background, this is our hope that we can bring to you individuals that are in the field treating patients and experiencing the use of VIVACE with their own techniques and their own trials and tribulations, and make your life a little bit more interesting and perhaps easier through the information that they have to share. This evening, we are really lucky to have Dr. Stacy Haynes with us. Dr. Haynes comes from Alabama, and she's working with two offices in Oxford and Birmingham. She is very active locally. She has gotten certified in mesotherapy. She's a member of the American Society of Aesthetics, mesotherapy, doing a bunch of things, and she's going to talk to you a little bit on that. She has an integrated approach to treatment and management of skin conditions, and today she's going to focus on how she's using the VIVACE with various skin types and teaching. One of the things I think that's very interesting is she has her own YouTube channel calling PRP Talks with Dr. Stacy Haynes, and that is an area that I know so many are interested in, PRP in treating conditions. She's also worked with tons of local and international celebrities, and so that's not easy to do too. You take on a lot of anxiety when you've got folks that are out there in the public and concerned about their skin type. So I'm not going to waste any more time. I'm going to turn this over to Dr. Haynes and let her share with you all of the wonderful things. And I'm not going to go into our mission. You can see the slide that we have at our mission, but ABM is really here to bring you great devices combined with great products, and I believe Dr. Haynes is going to talk to you a little bit about using our products as she executes treatments. And we're just really happy, as I said, to have Dr. Haynes join us tonight and share information with you. Dr. Haynes, you're on.
Okay, so can everybody hear me? Is this a good volume? Yes?
Yes.
Wonderful. Good. So first of all, greetings from the state of Alabama. Anybody who knows anybody from Alabama knows that the way we greet each other is, hey! So I'm going to say hey to everybody. Had a long day today, just very glad to be at home here and able to go over this webinar. My biggest thing is we started working with microneedling a long time ago, trying to figure out ways to do our mesotherapy less painfully. And so when this VIVACE came about, we were very happy, very happy. Okay, next slide. Okay, so this is what we're talking about. This is what all the excitement's about, is the new VIVACE machine. It's beautiful. If you've ever seen it in person, it's very sleek and tall and slender. When the patients see it, they all want to know, well, what is that machine? What is that doing? And it's a really kind of cool just to kind of have it in a room and, unplugged, of course, because you don't want anybody touching your controls, but just having it there just really and truly does bring about some questions. The good thing about this is the insulated needles are gold tip. They can go many different levels. We can change the frequency. We can change the millihertz. And there's just a lot that you can do with this. It also has a red light and a blue light. Of course, we all know red's for inflammation and blue is for bacteria. So, and I'm going to show you a slide in just a minute on how we can alternate these and still get a good treatment. Okay, next. Okay, so this is my talking point tonight. VIVACE and skin of color in African American men. Most people forget that the African American man really and truly does enjoy having some type of aesthetic procedure done, whether it be a facial, a microdermabrasion. Usually they don't mind having it done as long as there's no downtime. And as long as they're not going to scar, and as long as their face is not going to peel off, because that's the first thing most of my patients ask the men, what am I going to look like tomorrow? Am I going to be flaky, scary, peely? And the good thing about VIVACE is we can tell them, nope, you're not going to have any of those problems. So let's get started. Okay. Okay, so in the past, these were some of the things that we had to use to work with some of the things that African American men get. Most common diagnoses for our men are when you shave, you end up getting a lichenification of the skin. That lichenification gets pretty thick, and so a lot of guys, sometimes they just want to thin the thickness out. They also end up getting pseudofolliculitis Barbie. And when you get pseudofolliculitis Barbie, you know the hairs are notorious for bacteria, so you always have to worry about, bacterial things. And then they make these little hard, firm bumps. A lot of the guys try to shave them off or pick them off, and then they end up with discoloration, and they still have the thickening going on. Some of the other things are folliculitis, where you'll see like little bumps all around the hairs, and these are real hair bumps. You can usually see them on the lower neck, sometimes on the chest and the back. So what we started with initially was microneedling, and it was the roller, and that was a lot of hard work. When they first came out, they were plastic. You can only get them in very small sizes, like 0.25 and 0.5. Sometimes you could, later on, you could get them in 1.5, 2, and 2 millimeters. The downfall of this one is you had to have a steady hand to have equal pressure. If you eased up on it, then some areas may not get as well touched by the roller, whereas other areas got even heavier, and it was no exactness to it. And plus, it used to wear my arm out, especially once you got the right pressure and then you had to do it all over. The good thing is it did make the little openings in the skin, and you were able to apply the topical medication to help do what you wanted it to do. So the next one that came up was the micro roller with the metal needles, and that was a little better. It was very sharp. We really had to make sure we had the patient numbed up adequately. We found that the sharper and the longer the needle, the more numbing they needed. Of course, we used the BLT cream, which most of us use, and we just had to adjust the times just a little, just to account for that. Again, we still had to apply even pressure, and a lot of times patients would get a little upset if they were to see a little bit of blood or a piece of blood drop, because with the metal needle, you were going to see a little bit of blood. Okay, so we worked through that, and we were like, okay, well, this is good. What's next? There's got to be something better. Well, the next one was like the micro pins, where you had these changeable tips. You can change it out. You can dial up the size that you want it to dial up. You can go anywhere from 0.5 all the way up to 2, and if you push the machine a little bit more, you could get it out just a little bit more than 2. The good thing is that it was consistent. It would go, you'd have to, you can go all over the face, you can go all over the body parts, it wouldn't wear your arm out. The tips, of course, were disposable. You use it, you disposed of it. It was a lot of blood. So if your patient did not like blood, they were not going to like the micropin. So a lot of times we just tell them keep their eyes closed, and we would go through that. It would make them turn very red, and they would be red for the first anywhere from 12 to 24 hours. So if somebody was having something done and they had to go to a meeting, then the micropin, we'd have to tell them, maybe tomorrow you can do the meeting. So we would suggest they come later in the afternoon and just go home and just relax, and then get up the next morning, and then they should be okay. So that's the evolution of the roller to the pin. Before the roller, they used to have that stamp that you would just stamp on, and that was very crude and hard, so I didn't even talk about that. So in our practice, we used a lot of radio frequency. We had one machine we really liked, and we were able to, it actually heated it used the radio waves in which it would heat the collagen. And when it heats the collagen, it actually kind of helps to thin out the collagen, contract the collagen, make it a little softer and easier to work with. And of course, you could go all over the face or all over the body parts that you wanted to use. The downside of this machine is the tip that you used was very flat, and you had to get it you had to make sure that that tip was completely flat on the skin. If you were like around the nose area, it was very difficult to get that machine to fire up on the nose. Sometimes even at the side of the forehead, it would be a little difficult. Anywhere around the chin where you have the rounded edges, sometimes that would be a little difficult, so we'd have to manipulate the skin. The thing about the radio frequency machines is that you would get a little bit of peeling, because not only is it working on the layers underneath to work on the collagen, it is also working on the top layer, the epidermal layer. And so you are going to get a little bit of peeling. They'll have that grid-like pattern all over their face. So imagine if you have an African-American person who is a skin type 5 or 6, and you have this grid-like pattern that looks like little gray dots all over the skin, and those dots are on there for at least a day or two. So if it's a man, telling a man that you're going to have these little gray dots was not the most fun thing in the world to tell them. So a lot of times we'd plan it on a Friday, and then that way they'd have Saturday, Sunday for the little gray dots to kind of disappear, and then it would flake and scale and peel just a little as they were getting their tightening. I mean, we loved it, we thought it was good, but you know, they still had some issues with it. And then lo and behold, the VIVACE came out. So it was a combination of these two things. So first you had the microneedling part, and then you had the radio frequency part. The good thing with the microneedling, there were 36 needles, all gold plated initially, and then later, of course, they came with and those were all insulated, and then later they came with the non-insulated needle. It was very precise. It came at the same time every time. You didn't have to worry about how much pressure you held on there. All you had to do was just make sure that the skin was nice and numb and clean. And then you would just place the tip where you wanted it, and the machine did all the work. So I didn't have to sit there and worry about, is it in the roller, how much pressure I was applying. I didn't have to worry about all the blood that I would see in the micropin. With the VIVACE, you really don't see any blood at all, because you have the red and the blue light. The red light stops pretty much all the inflammation, so you're really not going to get much blood as you would in the micropin, because we're not hitting that superficial layer like that one is. The other thing is you can combine, since these treatments are combined, you can change your settings. So say, for example, if you were using a roller, you are pretty much stuck with that size. You cannot change that size. The micropin, you could change the size, but you had to be very careful of contamination, and you didn't want any issues or anything. With the VIVACE, it's easy. You just lean over, you change your settings. So for example, if you're working on the forehead, you may have one setting versus working on the cheek. So I was very excited when this machine came out. I was talking with the representatives, and they said, we've got a new machine. I'm like, I'm in, I want it now. I wanted it, so now I'll show you at the end what happened. Okay, so let's go on to the next slide. Okay, so this is one of our patients. He has pseudofolliculitis barbae. And everybody knows it's like the shaving bumps where the hairs are corkscrew shaped, and they actually, once they shave, because they are so sharp, they go back through and they puncture the skin. And when they puncture the skin, you actually get an inflammatory response. That inflammatory response makes you have bumps. So treatments that we've done in the past, we've done creams to stop the inflammatory response. We've done topical antibiotics and oral antibiotics. And that also helps with the bacteria from the hair, with the hair being stuck up underneath the skin. Most of these patients will come in and they will tell you that, yeah, my girlfriend or wife, she took a hot needle and she picked all the hairs out. And when they do that, don't forget they can get post-inflammatory hyperpigmentation. If you look at his pictures, you can see the little bumps, but you can also see the little pinpoint hyperpigmented areas, especially around his, I guess it would be his left perioral area. He had his girlfriend pick his bumps. And then, of course, he ended up with the discoloration. You can also see where he's been shaving and he's got the hyperpigmentation. And before in the past, we did a few intralesionals, and that's intralesional Kenalog. And we can always dilute or titrate up or down the Kenalog as strong as we want, or potent as we want, or as weak or mild as we want. So before we had this machine, I would do intralesionals, I would do some oral antibiotics if it was severe, and I would do a topical steroid and a topical antibiotic. And they would do okay. It would take a long time. Most men, I'm sure there's some men on the line here, they don't like to wait very long to see results. They want something very quick. So with him, we started off with microdermabrasion just to kind of exfoliate the skin, clean out the pores, and get us going. And then we started with VIVACE on him. We decided at the very beginning when we started using VIVACE of Skin of Color Men that we went pretty slow. You know, we just said, okay, we're only going to do 1 or 2 passes. We're only going to do one duration of milliseconds. We're only going to use 1 depth because we wanted to make sure that we were doing okay with it and didn't have any issues or anything. Well, when we got to this patient, before that, we realized that it worked, but it was just so slow. So we started becoming a little bit more aggressive. So like for him, we would start at maybe a needle depth of anywhere from 1 to 1.5, especially like on his forehead. On his cheeks, we would go up to maybe 2.5 on him. His skin wasn't as lichenified as another one you're getting ready to see. And then like on his chin, it looks like it would be lichenified, but it's not. It's just all post-inflammatory hyperpigmentation or the dark spots. And so for that one, we didn't have to have the needle depth as deep. So we actually changed the settings 3 and 4 times as we're working on a patient. Our radio frequency level, we usually keep it around 5, between 4 and 5. Sometimes we'll go all the way up to 6, but around 4 or 5. For his forehead, we did probably 1 or 2 passes. For his cheeks, we did about 2 or 3 passes, maybe even 4, depending on how thick it was or how lichenified it was. And on his chin, believe it or not, we only did 1 or 2 passes on his chin, because really on his chin, all you're really dealing with is the discoloration. So for that, of course, we did some hydroquinones and other things to try to bleach it. We did approximately 2 treatments, about 4 weeks apart. And this is what this is the after picture on the right. And we were very happy. He was very happy with that. And a lot of times, you know, you just have to tell them, it is not going to be like perfect after the first treatment. It does take more than 1. We have some patients that we have to do 3 or 4 treatments, and we tell them up front, you know, your skin is really thickened, your scarring is really bad, and it's going to take a little while. Okay, let's go to the next one. Okay, so now this one is very interesting. The one on our left is the before, the one on the right is the after. Before we started, he had acne, and he had nodulocystic acne. He had been a patient several years ago, and we had placed him on Accutane, and we had done the Accutane for the amount of time. It actually did dry up the bumps, but then when it dried the bumps up, he did end up with discoloration and scarring. And you can tell that it is very scarred in these areas. It is very thick. So when we did we attempted to do his first treatment, we could not even get the needle through. So we said, wait a minute, let's see what we can do to soften it up a little bit. So we did intralesionals all over his face, and we did a little microdermabrasion to see if we can exfoliate it, clean out some of it, And I think we did maybe 2 or 3 sessions of intralesionals just to get it soft enough. So then when we were able to actually start treatment, we were actually able to get the needle through. Then we knew we were onto something. We knew that this was going to work. So we ended up doing about 3 treatments 4 weeks apart. For him, we really went very, very aggressive. So, for example, I know everybody wants to know what we did on the cheeks. We pretty much went to the highest RF level between 6 and 7. We still left the pulse duration around 500, maybe 600. We went up to at least 5 or 6 passes on his cheeks. And we used the red light, of course, on this. The other thing is he did have a little bit of acne still present on his forehead and his cheeks. So when we actually went to those areas, we took it down a little bit. We did the needle level at about 0.5. We did a lower RF frequency, and we only did 1 or 2 passes on his forehead, and we did the blue light on the forehead to make sure that we were working with the bacteria. Just in case I didn't say what the depth was, we actually did the 3.5 on his cheeks. And if you can imagine, we actually had a little bit of redness with him, and he's a skin type 6, and normally we don't have any redness at all, but because we were so aggressive, we really got a little bit of erythema, which actually doesn't look like erythema, it looks like a dull purple color. And we were very happy. At about 3 treatments 4 weeks apart, this is what we got. But don't forget, we prepped him for many months before we actually got started. Since that very first one, we could not even get that needle to go through. Next. Okay, so this is one that he just came in and he just said, I shave every day. My skin is starting to thicken, and I really, really, really just want something that we can do to, 1, tighten up my pores, and 2, start to work on the thickening of my skin. So the first thing we did, of course, I always start with the discoloration and start with some kind of topical hydroquinone, just to get us going, just to start working on some of the discoloration. For this one doesn't take much at all. I think we ended up using 1.5 to 2 millimeters needles depth. We did anywhere from 4 to 5 radio frequency, and the pulse duration was really about 500. The passes, the very first time, we tend to be the most aggressive, where we're going to try to do at least 4 or 5 passes, especially when it's thickened like that. And then after the first one, then we can start decreasing it down, maybe doing only 3 or 4 passes. And again, we did 2 treatments about 3 to 4 weeks apart, and then we waited for the last one. We wanted to see how he was going to do because he really didn't have that much to work with. And then we did the 3rd one at about 2 months. This one was really a nice one. He turned out very well. The bleach cream kicked in and started working. So he started to get the discoloration started to decrease. He was happy. He's told all his friends and everything. Okay, next. Okay, so just to show you what it would look like on a Caucasian, so that way you kind of know the difference, and I'll show you a before and after in just a minute on an African-American male, so that you can see the difference immediately after. So this is one of the ladies that works in the office. We actually did the non-insulated needle. It's a little more aggressive, so when you use it, you don't have to do as many passes. You can see where the point of entry is and how the erythema actually radiates out from it. And you can see that redness. That redness usually lasts probably for about, I would say, for the first afternoon or the first day. It doesn't last that long, but you have to prepare your patient. Like, this is what you're going to look like. So that way, you know, they won't be like, oh my gosh, what are you doing to me? The last picture was like 2 weeks after it was taken, after the procedure was done, and you can already tell that she's actually starting to look a little better, and most of the redness is already gone. I think she had a little bit left on her jawline area. And a lot of times when you are around the jawline or about the around the eye areas, that you need to really and truly use that pinch technique to get the skin up off that bone, because if not, if you look at her lower level, you can see where it's a little bit darker erythema, because if you don't, you will get like little areas like that. It goes away, it doesn't scar or anything, but you know, you just want to lift the skin up so you can have the best result that you can. Okay, let's go to the next one. Okay, so what you want to know is, how do you get an African-American male in your office to do this? Well, here's me. I'm doing one at an open house. Actually, we were the first office to get the VIVACE in the state of Alabama, and we had a huge launch party. And so this is Jeremy Towns. He's a former NFL player. What did he tell me, for the Buffalo Bills? Is that right? Wait a minute, I'm going to make sure I got this right. Wait a minute. Yes, he's former NFL player for Buffalo Bills and the Washington Redskins. And so every summer he does a next level football camp, and every summer he always asks me, hey, can you come out, talk to the kids, tell them about good skin care, how to wash their face. He does it, I think the ages are anywhere from six to high school. And so we usually make up little goodie bags and we bring them. When we got the machine, we were like, let's use Jeremy. Jeremy is awesome. He is now a medical student. He's just getting ready to finish up his first year, and he did very well. He was used to platelet-rich plasma. He was used to getting all kind of things done. So he was really happy about this. And you can see me doing him, and you can see I have the light on. Well, the picture on the right is immediately after, and you can tell there is no redness. His cheeks are glowing a little bit, and he's happy. So a lot of times we'll tell you to start working on your celebrities in your neighborhood or celebrities in your city. And when you have your launch party, or when you have your open house, you can make sure that you have one of your African-American males there, because them putting their picture on your Facebook page or your Instagram page will actually increase your business, because we highlighted Jeremy as a former NFL player, and every guy was asking me, okay, how do you know Jeremy? What did he have done? Can I get it done? What is it going to look like? And we were able to show them these pictures. Okay, let's have next. I know they told me I only had a few minutes to talk, so I think I'm almost there. So the tagline for VIVACE is "Love the Skin You're In." We did our launch party because we were the first. We said "Be Vivacious" with VIVACE, and we actually had a red carpet event. It really was red carpet. We had to step and repeat with our name. We had local celebrities. We had the newspaper there. We had a TV station there. Everybody came out for our Vivacious with VIVACE. And the great thing is we highlighted Jeremy, and then he was able to talk about it when he talks with all his football friends. So I think my time is up. They told me I only had about 35 minutes to talk. So are there any, I forgot one more. Don't forget that you have the VIVACE experience for your patient response. We had the experience kit that we worked with, and it actually had the glide. So after you numb them up, then you can apply the glide before, you can apply the glide after. You can also use the mask. The mask feels really, really good. And what you can do, you can either put it on immediately after the treatment, and that helps with a lot of the redness too. And usually after you do that, by the time they're walking to the door, you can see the redness start to go away. I have not had the opportunity to use the Soothe Recovery Spray, Cleanser, or Balm, but I have used the glide, and I have used the mask. So I think I'm done. Any questions?
I have one question. This is Aisha Barron. I'm out of Atlanta, Georgia, and I just purchased the Vivace.
Oh, congratulations.
Thank you. I was just wondering if the difference between the insulated and non-insulated. Non-insulated is more aggressive. Is there some sort of ratio in which, okay, if you were to use, the insulated, 3 or 4 treatments, is that equivalent to like 1 non-insulated treatment, or is there any type of correlation, as far as stress?
Yeah, I mean, there's not a correlation that they have documented or anything, but just in our experience, we found out that when you use the non-insulated, that you just have to be a little more careful as to the number of passes and then the duration. Instead of doing maybe 5 passes, maybe we'll only do 3 passes, because once it starts becoming inflamed, and you can see that wheel around the in puncture site, you can actually see where it's going. So a lot of times we'll just decrease the passes.
Okay.
Personally, I really, really, really like the insulated ones. I don't have to worry about it. I can get aggressive as I want with the depth of the needle, the duration, and then the number of passes.
Okay. All right. And one additional question. When using it on men who have hair-bearing skin on their face, would you say if someone wants to wear, or if they're currently wearing a goatee, but they may have some, hair bumps in between, those hair follicles in which they actually have hair on their face and aren't shaven, do you treat those areas, or do you kind of just avoid that or ask them to shave before the treatment?
No, I don't ask them to shave, because then you're getting to more issues and stuff with hair bumps and everything. Usually we avoid the hair areas, as you can see on the slide with Jeremy. I pretty much stopped in his beard, where I got to his beard. If they do have little individual lesions, I will do intralesionals in those. And then if they do happen to shave, then of course we'll get them. But just usually we try not to get them to shave. We try to work with what they have.
Okay, thank you.
You're welcome. Any other questions?
Great. Well, thank you very much. This is really very informative. I think the wonderful thing about what Dr. Haynes is doing is her experience with the different skin types. The question of the non-insulated and insulated, the non-insulated definitely do well with darker skin types and fluorescent bias and above, whereas the insulated, you can be a little bit more non-insulated with other skin types. So you might want to just find out a little bit more about how you also use insulated, non-insulated based on the skin type. Dr. Haynes giving you a great view of what achieving with the different skin types, and I appreciate that. Dr. Haynes, have you used the Vivace with PRP at all? I don't think you did.
Oh, yes, I've used Vivace with a lot of things. Yeah, it does very well with the platelet-rich plasma. Of course, everybody, if you don't know, platelet-rich plasma is where you draw your blood, spin it down, take the serum and use it either topically or injectable to help with the collagen, help to plump it up, help to rejuvenate and reinvigorate those skin cells. The collagen helps to plump it up. It does a very nice job in combination. And a lot of times we'll do the Vivace first because it's really, it's good to get started with that. It really softens as you get to working with it, depending on how many passes. It really does help to soften. So if you're doing injectables, it goes in very well. It helps with the pores. And then if you're plumping up the collagen with the platelet-rich plasma, they get that rosiness, they get that glow, they get that fullness that they're looking for. So the combination is really good. And I think I might have done one of those on the YouTube channel on PRP Talks with Dr. Stacy Haynes. I think there's one on there. If not, there's one pretty close to it.
Great, thanks for that additional input. So I'll give one last chance if there's anybody that has any questions, and if not, I want to thank all of you for joining us tonight. Hope you learned something. We appreciate the time from all of you wanting to hear more about the VIVACE, and we certainly appreciate all of you who have purchased the VIVACE and are using it. The Aesthetics Biomedical team is always available to help you. Don't hesitate to call us. I know your distributors are there to help you as well, but don't hesitate to call us if we can help out in any way, shape, or form. We've launched the new experience kits that you may be seeing, rather than needles where you're going to get a needle, the mask, and the individual size boost. Some of the previous owners haven't been using that. Some of the new owners of VIVACEs are using that and loving it. So we're excited about the change in the experience packaging, and hope that all of you get to love it as much as we love it. So listen, this is a great night. We wish you all happy holidays. I don't know if we'll talk to you before Christmas, but certainly I know we won't be engaged with you much before Thanksgiving. So have a safe and wonderful holiday with your family and friends.
Great. Thank you guys so much. Thanks for having me.